This podcast does not provide medical nor legal advice. Please listen to the complete disclosure at the end of the recording.
Hello and welcome to Everyone Dies, the podcast where we talk about serious illness, dying, death, and bereavement. I'm Marianne Matzo, a nurse practitioner, and I use my experience from working as a nurse for 46 years to help answer your questions about what happens at the end of life.
And I'm Charlie Navarrete, an actor in New York City, and here to offer an every-person viewpoint to our podcast. We are both here because we believe that the more you know, the better prepared you will be to make difficult decisions before a crisis hits.
So welcome to this week's show. Please relax, get yourself something strong to drink. Maybe, I don't know, pie, cake, cookies.
Martini.
Or an apple. You can have an apple.
Mm-hmm.
And thank you for spending the next hour with Charlie and me as we talk about how to help someone you care about decide about using hospice care. Like the BBC, we see our show as offering entertainment, enlightenment, and education and divided into three halves to address each of these goals. Our main topic is in the second half, so feel free to fast forward to that schmooze-free zone. In the first half, Charlie talks about how to manage our worry and a recipe that you could take to your next funeral lunch. In the first half, Charlie talks about how to manage our worry and a recipe that you could take to your next funeral lunch or whip up before you go to your next funeral lunch. In the second half, I'll be talking about how to talk with someone about hospice care who's trying to decide if they want to use that type of care. And in our third half, Charlie has obituaries that people have written for themselves. Charlie, what's new?
Well, let's see here. Nothing.
Well, that's life in the big city, huh?
Yeah, exactly. Actually, the weather's kind of, beginning to sound like Sonny Elliott. Sonny Elliott was this wonderful weather forecaster. We were kids in Detroit. Just very, very funny and amusing man. I don't know why I'm still stunned by this, but I mean, just the variation in temperatures, Marianne, it's nuts. Just peaks and valleys. Well, I guess it's the way of the world now. And that's all there is to it.
I was feeling this week like this has been the longest spring ever because spring really started like at the end of February. My lilacs were blooming at the end of February.
Yep. Yeah.
And it's, I know it's only April, but it's like, all of the spring plants have already done their thing.
So what happens? They just die and that's it? You're done for this spring?
Some plants, like, peonies and irises only bloom once. My roses will keep blooming.
Okay, right.
Until it gets too grossly hot, and then they'll take a break and do it again in the fall. But yeah, for some plants, it's one and done.
If I already said this before, tell me. But there was.
Yeah, you said it before.
Yes, thank you. The cherry blossoms, the cherry blossom trees.
Yeah.
So, the biggest, the largest amount of these bad boys are in Washington, D.C. They were a gift from the Japanese emperor over 100 years ago now. So they've just been, going to town for all this time. Well, the water level on the Potomac has reached higher ground, that hasn't been seen since forever. There's some occasional flooding, but this thing, the water elevation the water level just went so high. It's this awful picture of these trees not being underwater, but like halfway up their trunk, they're underwater, and the roots are sensitive. So 150 of these cherry blossom trees have to be pulled out. They've been killed because just oversaturated.
Well, it's a good thing the Japanese are going to give us some more.
I don't know. We haven't taken care of these, so But yeah.
Oh no, I thought I read that they were giving. They were
I
going to give
didn't know
more.
this. Oh, so they're sending more? That's damn nice.
Well, maybe I hallucinated it.
Mhm.
Maybe it was wishful thinking, but I thought that I read that.
I mean, we have plenty here, but that would be nice.
Well, just tell the Japanese you don't need any more. I mean, I don't know.
I'm going to contact the prime minister and let him know that we're probably okay. So,
but if they have any extra sushi, they could send that along.
Sushi. In our first half, speaking of food, our recipe this week can help you have a it's together. Okay, got it. Our recipe this week can help you have a worry-free start to your day or a worry-free offering at your next funeral lunch. This week we have blueberry banana baked oatmeal, which is easy to make and perfect for a quick, healthy breakfast or snack throughout the week. Yeah, that ain't going to fly in my house. You will not only feel good eating this, but you will feel good making it. Bon appetit.
I'm telling you, if you've never had baked oatmeal, it is a whole different thing than that slop that our moms put in our bowl on the winter mornings when we were kids. I always remember my mother making oatmeal or cream of wheat, and she'd say, it'll stick to your ribs as you have to walk to school in the snow.
I remember that, stick to your ribs, yeah.
Yeah.
All right, but I'm sorry. So what is it with it? I don't think I've ever had baked oatmeal. So what makes baked oatmeal?
It's just so good. And then you put the fruit in it and some brown sugar in it, and the top gets all crunchy. And seriously, if you ever come visit, I'll make you some. I make it all the time here.
So instead of slop being dumped on your plate, it is.
It's like an oatmeal cookie.
Oh.
It's like an oatmeal cookie brownie, like you make it in a brownie pan, but it doesn't have all the sugar like of a brownie, and it doesn't have any chocolate. But I suppose you could put chocolate in it. It's just good. It's not all wet and. I have a thing about consistency. I like a certain consistency, and oatmeal in a bowl. I don't know. It's sort of like wallpaper paste,
Oh, yeah. Oh, yes. Perfect. Wallpaper paste. Yeah, I get that. Moving on. Dr. Robert Lay is the author of The Worry Cure, 7 Steps to Stop Worry from Stopping You. He says that people worry because they think something bad will happen or could happen, so they activate a hypervigilant strategy of worry and think that if I worry, I can prevent this bad thing from happening or catch it early. If you want to help yourself by worrying less, here are some ideas to help. 1. Set aside designated worry time and use it to make a list of worries. What exactly are you worried about? Don't say everything, it's not specific enough. Analyze the list. What is the nature of the worry? 2. Practice mindfulness, which can raise non-judgmental awareness of present thoughts and emotion. We have a list of our mindfulness podcasts in the show notes. 3. Accept the worry and move on. Instead of trying to force yourself to stop worrying, you may want to try a different strategy. Acceptance. 4. Remember, it's never as bad as you think it will be. The what ifs are always way worse than how you feel when something actually happens. 5. Cry out loud. Dr. Lay shares that when you are crying or angry, you are not worried. 6. Talk about it. Find a trusted ally, counselor, or therapist and give voice to your worries. 7. Keep your hands busy. Gardening, sewing, crocheting, knitting, whatever. The point is, you can't worry and do something dexterous at the same time. 8. Exercise regularly. Exercise can affect brain activity of serotonin, considered a happy brain chemical. Please go to our webpage for this week's recipe for blueberry banana baked oatmeal and additional resources for this program. Your tax-deductible donations are always welcome so that we can continue to offer you quality programming. Thank you in advance for making your donation at www.everyonedies.org. That's every, the number one, dies.org. You can also donate a bit every week at our site on Patreon. Just go to www.patreon.com and search for Everyone Dies. Patreon is spelled Patreon. Marianne?
Thanks, Charlie. When someone you care about has had all the treatments available to them, and those treatments have not stopped the disease, they may be told it's time for hospice. But even though people may be familiar with hospice support, they may know someone who's received incredible care at the end of life from a hospice agency, they may still resist enrolling in hospice. Deciding to enroll in hospice can be extremely difficult, even for patients and family members who are well-informed and realistic about where a disease process is headed. Many people, family members, and even healthcare practitioners may see the move to hospice support as giving up. And the giving up is not only about the prospect of a cure, but on life itself. We want to believe that there is always another pill or treatment that will allow us to live forever. Research findings have demonstrated that hospice care can improve how patients experience the end of life, as well as improving the quality of life. Yet people will delay utilizing their hospice benefit. If you were to ask why they do not want hospice support, here are some of the reasons that you might hear. 1, doctors can be wrong. What if I'm not terminal or live longer than 6 months? Well, yes, doctors can be wrong, and the hospice team will do their own assessment of your situation before you enroll. Assuming you meet the clinical criteria to enroll, the first benefit period is about 90 days, followed by 90 days, and then another 60 days after that. At the end of each benefit period, your condition and records are reviewed. As long as you continue to meet the clinical criteria, you can stay enrolled in care. It's not common, but some people are in hospice care for many more than 6 months. But also, you might graduate from hospice care. Every year, about 13% of hospice patients are discharged or leave hospice prior to death because they decide to resume curative care, change providers, or because they feel better and their disease is not actively progressing. Number 2, I'm not ready to give up. Maybe another treatment will come along that can help me. That'd be great. People who enroll in hospice can discharge themselves at any time to resume curative care. And they can re-enroll if they meet clinical criteria. Also, treatments that you think might be curative, like some chemotherapies or radiation, for instance, can actually have a powerful palliative or comfort-oriented effect and might be covered by hospice. You don't know until you ask. So you can enroll and unenroll in hospice as many times as you want to, if that's what you want to do. Number 3, well, hospice is where you go to die. They just take away all your meds, pump you full of morphine, and then you're gone in a few days. Well, first, more than 96% of hospice care is delivered to people in their own homes. If they can't be cared for at home, hospices have arrangements with nursing facilities, and some have their own residences, typically much more home-like than nursing homes for inpatient care. But hospice isn't typically a place at all. It's a philosophy of care. Second, the hospice team will review all your current medications and may recommend that you discontinue some of them that aren't contributing to your comfort. Now, This could be alarming to patients, but very frequently reducing the number and complexity of patient medications can have great effects. It's not uncommon for people to feel better on fewer medications when their bloodstreams and brains clear of the drug effects and interactions of all the other stuff they were taking. Any medication that you're using that help you feel better or function better will likely be continued. Third, hospice clinicians have a broad and very sophisticated set of treatment tools, including drugs, that they use to control pain, make it easier to breathe, control anxiety, ease fatigue or nausea, or any other distressing symptom. Morphine is just one of those drugs used. Hospice nurses also pay attention to emotional distress, psychological issues, and even spiritual concerns, and they look after the family members as closely as they care for patients. The hospice team is made up of a nurse's aide, a physician, a social worker, chaplain, volunteers who all work together to make every aspect of a person's life as comfortable and pain-free as possible. That said, the only member of the team that really has to be seen is the nurse. Everyone else is optional, and patients and families are closely consulted about what they need and what they want in terms of care. While it's true that about half of hospice patients are in hospice for less than a month, it's mostly because they or their physicians waited way too long to start care. 4. I can't possibly afford hospice care on top of all the other medical bills I'm paying. Well, for people on Medicare, hospice is a fully covered Part A benefit. Hospices are paid a small per diem or daily amount, and they cover the expenses for the services for the entire hospice team. All the drugs, all the equipment, and all the supplies required to care for the person who has the terminal condition. If they need treatment for something unrelated to the terminal disease, let's say they break a bone, that care is covered by Part B of Medicare. If the patient doesn't have Medicare, most private insurance plans and Medicaid programs have benefits modeled on the Medicare hospice benefit. In rare cases, when patients have no insurance coverage at all, many hospices have a strong commitment to providing care regardless of the person's ability to pay. 5. I really like my doctor. She's seen me through so much. I don't want to get someone new at this stage. Well, while all hospices have staff or contract practitioners they work with, many of whom have specialized training in hospice and palliative care, people can keep their own doctors when they enroll in hospice. Your current doctor can continue to supervise your care, coordinate with the hospice medical director and team, if that's what you want. So something you can do is you can suggest that people give hospice a try, and if they don't like it, they can discontinue it. Well, it's not DoorDash delivering your favorite pizza. It's the best possible care that you can get delivered right to your home. You don't have to worry if the pharmacy will have your pain medications available, nor do you have to drive or send someone to get them, nor do you have to pay for them. Everything you need related to managing your symptoms, related to your diagnosis, is brought to you. It's worth a try. If you don't like it, you can stop. Any questions about that, Charles?
So, yeah, clinical criteria. What do you mean by that? What? Sorry, wrong question. So, what's the clinical criteria for someone to be in hospice?
Well, sort of a false one is that your healthcare practitioner has to say that you have less than 6 months to live.
Uh-huh.
And there's no way that we know that.
Oh,
so it's more of what Joanne Lynn used to call, or still does call, the surprise question. Would you be surprised if this person would not still be alive in 6 months? And if you say, oh, no, I wouldn't be surprised, then the referral for hospice is valid and worthwhile care. The rest of the criteria is long and involved, and people can look it up. I'll put a link in the show notes so you can see. And it depends on the diagnosis. So if you have Alzheimer's disease, there's a whole list of criteria. If you have heart disease, there's a whole list of criteria. So it's involved. It's part of the nurse's assessment when they go out, to do an admission. But if you're interested and curious about what those criteria are, I'll put a link in and you can take a look at them. But it's a long kind of list because it's by diagnosis.
Right. Oh, okay. And I'm sorry, you said, and I don't remember the end of it, something that hospice is not a place of care, but what?
It's a philosophy. It's a philosophy of care. So because it's not a place, it occurs in your home, wherever your home is. So if you move to your daughter's house or if you are living in a nursing home, wherever you live, that's where your hospice care is. So it's not a place, it's a philosophy.
You'd also, I'm laughing because you mentioned medication. This may be aside from the issue, but it just seems, Americans just seem to over-medicate ourselves. It seems like more than anyone else on the planet. Any thoughts?
Well, from my experiences, people are much more willing to say, well, can't you just give me a pill? Think of all the shows that we've done about diet and exercise, in good diet as medication and exercise as the thing that can fix an awful lot. And in seeing patients, I've had patients say, yeah, but don't you have a pill you could give me? Yeah. People would rather have the pill than get up. I mean, not everybody, but, than get up and go for a walk.
Yeah.
So, I think that healthcare practitioners and patients are complicit in that. And, hopefully people will hear it enough from us that they'll get up and go for a walk. But
yeah, I mean, I don't know. And I make the joke that just so many people seem to be willing to be a walking pharmaceutical. I don't even like taking vitamins. It is a vitamin. It's nothing bad. I'm older now, but yeah, no, you're right. People just seem to think, I'll just pop a pill and that should take care of it.
Well, and some people pop the top of a beer can, or everybody's got their way that they cope.
Yeah. Good point. The other thing. So, I knew that hospice is covered, by Medicare, Part A. But like you mentioned, sometimes people will go in and out of hospice. So you're in hospice, you're covered, you're out of hospice. So does Medicare, still cover it every time you go back into hospice?
Mm-hmm. Yep.
Cool. Very good.
Yep. It's a benefit if you meet the criteria and you have the referral. Yes. Yep.
Very good. Mm-hmm. Something to look forward to. For our third half, if you're reading this, then it means I have died from my battle with cancer and my family are posting my final message on my behalf. These are the words 25-year-old Daniella Thackery wrote on her LinkedIn page. She announced her death on social media, stating, "I chose not to mourn the life I was losing." She worked as a people administrator for an advertising agency in Leeds, England, describing herself as very healthy and active until she was diagnosed in July 2023 with cholangiocarcinoma, a cancer that forms in the bile ducts. According to the Cleveland Clinic, it's a rare and aggressive cancer that spreads fast and has usually metastasized by the time it's diagnosed. She planned her death announcement and asked her family to post a pre-written eulogy to her social media accounts. Thackeray began by explaining the type of cancer she had, writing, "Firstly, I just want to say that not all cancers are caused by lifestyle choices. In some cases, it's genetics, or unfortunately, it just happens. In my case, despite me being very healthy and active, a cancer started in my bile ducts, which was not caused by anything in my control, and my life was never the same again. Cholangiocarcinoma is a rare aggressive cancer with often no obvious causes and no cure." The Mayo Clinic says smoking, older age, and diabetes may increase the risk of developing cholangiocarcinoma and explains it is a very difficult type of cancer to treat, with surgery, liver transplant, chemotherapy, and palliative care recommended. Thackeray had shared on social media she'd undergone a liver resection and gallbladder surgery 8 months ago. "I really, really do hope that in the years to come, more research is done about this horrid, cruel disease so that more lives can be saved," she wrote in her final post. So with that being said, although we can't control what happens to us, we can control how we react. I chose not to mourn the life I was losing despite being so devastated, but instead to enjoy every moment I had left. As I have always said and believed, you should enjoy the little things in life and cherish every moment. Romanticize your life. Do whatever makes you happy and don't let anyone take the joy of life away from you. She continued with, "I loved my life. Everything I had achieved was what I wanted. I loved my job, my fiance, my family, my friends, and my dog, and the house we were going to buy and the future we were making for ourselves. Leo, my fur baby, was definitely brought into my life to help brighten my darkest day." Leo was her dog. We included a picture of her and Leo walking on the beach. She added, "You are braver than you believe, stronger than you seem, and smarter than you think. But the most important thing is, even if we're apart, I'll always be with you." He was quoting Winnie the Pooh. Thackeray's post has since gone viral, with more than 50,000 reactions on LinkedIn and 2,300 reactions on Facebook. Thackeray ended on a note to her fiancé, Tom Calvert. "And lastly, to my dear, beautiful Tom, I love you and always will. Thank you for supporting me and bringing so much love and happiness into my life. Go enjoy your life now. You deserve it. Daniella." Her heartbroken fiancé Tom paid tribute to his beautiful and brave partner after she announced her own death. "My beautiful, brave fiancé, you continue to inspire so many others like you inspired me each day to keep going. Your courage, determination, and kindness was infectious, and you deserved the world. Unfortunately, the world let you down, and your future was taken away from you in such a cruel manner. But you lived such an incredible life, and you were so loved. I'm glad that Daniella's words resonate with so many others. If she could see the traction her message is getting, she would be so proud. She was the most ambitious, intelligent, and professional person I have ever met and was so passionate about her job. Her employer supported Daniella in such an incredible way. She felt so valued and was able to spend her precious remaining time making beautiful memories with the people she loved. I miss you, Daniella, and I'm so incredibly proud of you now and forever."
Mm.
Ladies and gentlemen, next I'm going to read a story of a 5-year-old who wrote his own obituary before he died. As longtime listeners know, my son Michael died a few years ago. He was 21. So you'll understand if occasionally I take a pause or I choke up a bit. This is the story of a 5-year-old who wrote his own obituary before he died. Obviously, he wouldn't write his own obituary after he died. His parents spent 9 months watching 5-year-old son Garrett battle a rare form of pediatric cancer. Through all the painful treatments, Garrett never lost his sense of humor. We've included 2 YouTube videos so you can experience Garrett's spunk for yourself. Here are some excerpts. A preschooler with terminal cancer helped write his own obituary and requested an unforgettable celebration instead of a funeral. Now, the story of his brave short life lives on in a children's book. 5-year-old Garrett Mathias was diagnosed with a rare form of pediatric cancer in 2017. He got rhabdomyosarcoma, which is a sarcoma, a tumor in his temporal bone, in his head, and then in his ear, then in his inner ear. Mom Emily Mathias explained she and the family were at the hospital for 2 weeks and found that his tumor was treatment resistant, meaning there was nothing else they could do for him. The parents and Garrett started a bucket list, and one of the things that he wanted to do was be a boxer when he grew up. So with the help of the Title Boxing Club, Garrett became a boxer for a day while he was still in the hospital, learning to throw a few jabs and showed off his skills to the crowd, even knocking out his grandpa. Though what really wowed everyone was Garrett's inner strength and the courage he showed in the battle he'd already been fighting for 9 months. Garrett returned home shortly after that day to live out his last month, but that wasn't the end of Garrett's story. After he died in July 2018, the obituary he wrote, which included his affirmation that he would become a gorilla after he died and that he wished to be cremated. Like when Thor's mommy died, he said. He also had some ideas for his funeral, specifically requesting 5 bouncy houses, snow cones, and an appearance by Batman, all of which he got. His father Ryan stated that Garrett wanted people to come together and celebrate because he did not like funerals. He'd been to a few of them, and everybody was very somber and sad, and he was like, no. He went, at my funeral, it's going to be a happy time. He knew if you do a party instead, everybody is going to have fun. There might be a few tears shed, but it will be a good thing. His mother added, it's a little bittersweet. You know, we were so honored that the community helped us put all of this on. We're just hoping that he's looking down from his gorilla in his tree and is happy with what he is. Garrett's story became a children's book titled Dirty Stupid Cancer. The book uses words and phrases pulled directly from Garrett's obituary. The funeral home had a list of questions, of statements, and Garrett filled those in. So I'm going to read these now for you. So it starts with Garrett Michael Mathias, a.k.a. the Great Garrett Underpants. Born March 26, 2013, died July 6, 2018. And here Garrett fills in the blanks. My name is Garrett Michael Bofius. My birthday is, I am 5 years old. My address is, I am a bulldog. My favorite color is blue and red and black and green. My favorite superhero is Batman and Thor, Iron Man, the Hulk, and Cyborg. When I grow up, I'm going to be a professional boxer. My favorite people are Mommy, Daddy, my sister, Delphina. Her birth name is Delphina. The grandparents with the new house, Frederick and Cheryl Kruger. The grandparents with the camper, Daniel and Nita Mathias. My cousins, Grady, that guy I took down that one time, Luke, and London Marie. My Aunt Jenny, my Aunt Jeanette, and stinky Uncle Andy, Andrew and Jeanette Kruger. Those two guys, my uncles, Christopher Kruger and James Taylor, and Batman. Things I love the most. Playing with my sister, my Blue Bunny, thrash metal, Legos, my daycare friends, Batman, and when they put me to sleep before they access my port. Things I hate. Pants. Dirty, stupid cancer. When they access my port. Needles and the monkey nose that smells like cherry farts. I do like the mint monkey nose, like at Mayo Radiation, and that one guy that helped me build Legos. His name was Randy. When I die, I am going to be a gorilla and throw poo at Daddy. Burned or buried. I want to be burned, like when Thor's mommy died, and made into a tree so I can live in it when I'm a gorilla. Big or small funeral. Funerals are sad. I want 5 bouncy houses, because I'm 5, Batman, and snow cones. Garrett endured 9 months of hell before he lost his battle with cancer. During that time, he never lost his sense of humor and loved to tease the doctors and nurses. From whoopee cushions and sneaking clothespins on their noses to hazing the interns and new staff doctors, he was forever a prankster. Nothing caught people off guard as his response to, "See you later, alligator." Garrett would respond, "See you later, suckers." The great Garrett Underpants. So, folks, we have a couple of YouTube videos showing Garrett in all his glory. So check them out. Thank you for listening to our podcast. That's it for this week's show. And from former President Charles de Gaulle, the graveyards are full of indispensable men.
And I'm Marianne Matzo, and we'll see you next week. Remember, every day is a gift.
This podcast does not provide medical advice. All discussion on this podcast, such as treatments, dosages, outcomes, charts, patient profiles, advice, messages, and any other discussion are for informational purposes only and are not a substitute for professional medical advice or treatment. Always seek the advice of your primary care practitioner or other qualified health providers with any questions that you may have regarding your health. Never disregard professional medical advice or delay in seeking it because of something you have heard from this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Everyone Dies does not recommend or endorse any specific tests, practitioners, products, procedures, opinions, or other information that may be mentioned in this podcast. Reliance on any information provided in this podcast by persons appearing on this podcast at the invitation of Everyone Dies or by other members is solely at your own risk.